The therapists, when they first started using Vapotherm, would complain because for the first 2 days, all they do is suction and suction the patient. Well, it's because these patients would come to us with these big consolidations or this old retained secretions, and as we were rehydrating the mucociliary escalator and getting that airway clearance mechanism start working again, these secretions started to move out. So that's why the therapists were suctioning so much. And after a day or two, after we got rid of all these retained secretions, then these patients would start to breathe better, they felt better, they started coming, stayed off the vent longer on their trach mask trials on the Vapotherm. We'd get them off the ventilator, and then after a few days, if they did well and they could follow our decan protocol, we were able to decannulate them and then get them out of the hospital.
With the cool mist systems that we used in the past, multiple times per shift, our staff had to go to the units and drain the water out of the systems. And for lack of a better term, it was a disgusting experience because there was water mixed with sputum floating in these tubes at the patient's bedside. And our staff had to go with a little drain and drain it 2-3 times a shift. And the tubing was draped across the floor, hanging on the patient's bed. And now with the Vapotherm, there's virtually maintenance free. We put the patient on, we have a full water bag, we check the patient throughout the shift for suction needs, and we change the water bag as needed. So it's greatly decreased the level of work that the staff had to do at the bedside with our patients.